Madhura. I am working as a consultant physician in Mani Super Speciality Hospital, KR Puram, Hassan. I have been in private practice for the last 10 years, and I have gone through various sections of training in this expertise area of critical care and nephrology. I'll be talking to you today about hypertension and management of hypertension and its complications. As you all know, hypertension is a vastly increasing incidence topic here in the existing population. The incidence and prevalence of hypertension, especially in the young population, has increased over the last 5 to 10 years. The reasons being contributed by their diet, lifestyle, or genetic factors. There are multiple risk factors which can contribute to the existence of hypertension. If we have to see that what are the risk factors which contribute to the existence of hypertension, we can generally vaguely divide them into modifiable and non-modifiable. Modifiable are those things which we can modify by changing our diet, lifestyle, or by our medical interventions. So those include our dietary pattern, our lifestyle habits, and our general other habits like eating junk food, smoking, and managing alcohol, and all the other habits which contribute to the existence of hypertension. Non-modifiable are those factors, like as you all know, aging is one of the important factors. Aging will contribute to increased thickness of the blood vessels, which increases blood pressure. So this is a generally accepted non-modifiable risk factor. Other thing is gender. So males and females have their own risk of developing hypertension. And ethnicity. Normally are African Americans and Native Americans. These group of populations, they have increased risk of hypertension per se related to their race. And few congenital syndromes and genetic mutations. So everybody in their own way, in their own genetic mutation, they will contribute to some amount of raising blood pressure in their body. So these are the risk factors which can contribute to the development of hypertension. When do we say the patient is hypertensive? So there is no as such clear-cut guidelines that we have to evaluate a patient at this particular age for hypertension. Generally, it is advisable that anybody who is of more than 18 years should get their blood pressure checked in a hospital or by a clinician at regular intervals to see if they have really developed hypertension or not. Before developing strict hypertension, there is a term called pre-hypertension. So the patient may have increased systolic or diastolic blood pressures for which he has to modify his diet and lifestyle to some extent to avoid going into severe hypertension. So what are the things which they can do by their lifestyle modification through which they can avoid hypertension? So generally we say diet modification. We have a term called DASH diet. DASH is dietary approach to stop hypertension. So mainly we advise people to increase their intake of fruits and vegetables and low calorie foods and avoid energy dense foods like cheese and other junk food which they regularly take. So to avoid the acute rise in blood pressure. So these changes don't happen overnight. Like you can't say a patient to avoid to consume totally healthy food today and stop all junks from the next day. This can't happen generally. So what we tell them is to make a dietary plan. So this diet plan should include a basic 5-meal approach. So what normally patients say is like they take breakfast, lunch, and dinner at 3 regular intervals, as most of us do. But what happens in DASH diet? In DASH diet, we mainly advise them to increase the frequency of the meal intake so that the amount of carbohydrate or salt consumed in each meal comes down. So as we all know, regularly the salt intake of at least 1 teaspoon will give us 2.2 grams of sodium per day. This is a normal measurement which we tell people that at least 1 teaspoon of salt will give you 2.2 grams of salt per day. So which means a single person has to take less than 1 teaspoon of salt every day. It is very difficult to follow this when you come to the measurement of salt or whenever you come for food preparation and all these things. So what we normally do is do not add any extra salt for your already prepared food. So the already prepared food, even if it has less salt intake, it has maximum amount of salt to increase your blood pressure. So if you add extra salt, then the amount of medications or the amount of energy which is required to decrease the blood pressure with this extra salt goes on adding. And whenever you consume the other related products like pickles or any other Szechuan sauce or some Chinese items where you have increased salt intake. So such junk food will increase your salt intake in the salt content in the body, which can contribute to the existence of hypertension. And the second important thing is physical activity. So as we all know that the physical activity has become very less, especially among the younger generation these days. So most of us are going back to the sedentary lifestyle. Either it may be our like regular desk approach, or the amount of physical activity which we do, which we think it is enough for the body. Because regular aerobic physical activity means at least 150 minutes per week of good physical activity, which will increase our heart rate to at least 30%. So that is about walking for about 1 kilometer in about 10 to 12 minutes. So this states there is a regular aerobic physical activity, and at least the person should be walking 3 to 4 kilometers per day. But whenever we say this, so at least 3 to 4 kilometers per day, most of us have a misconception that the 3 to 4 kilometers can be covered in about 1 to 2 hours. But that is not aerobic physical activity, which can help for the reduction of hypertension. So aerobic physical activity requires at least 1 kilometer walk in 10 to 12 minutes per day. And this should go on for 150 minutes per week. So even if they take 2 days off per week, at least 5 days of vigorous physical activity should be planned for the decrease in hypertension. And other lifestyle factors which they have. So they should try and quit smoking. So especially managing hypertension, when we come to managing hypertension, what I would like to say to people is that maintain strict adherence to medication. So adherence to medication is one of the important factor which we tell people, because once the BP is not controlled within the normal range, there is a general tendency in the people that they will stop taking medications. So, but this not only helps, this not only makes us to control hypertension, even makes it difficult to control hypertension, but it also creates target organ damage. So as we all know, hypertension affects almost all the organs in the body, critical organs in the body. There will be changes in the heart, changes in the brain, changes in the kidney, and all the other blood vessels whenever the blood pressure goes up. So our main intention is to bring the blood pressure to target levels, and also to prevent the complications of existing hypertension, that is the target organ damage which we talk about. So managing hypertension, maintaining adherence. Patient's role is in keeping the tablets and whatever the prescription at whatever dose the practitioner has given them. So taking them regularly and strictly adhering to that regimen. So few patients might take prescribed medicines once a day, or exactly half what has been prescribed. So generally it is better to avoid any modification in prescription, the self modification, and to stick to a clinician, so to avoid these changes which can happen in the blood pressure over time. Target organ damage is a very critical aspect in managing hypertension. So as I told you earlier also, hypertension has a critical role in the management of cerebral blood vessels and in the management of the heart and kidneys. And kidneys are one such organ, so especially which is affected by the uncontrolled hypertension. So mainly it depends on three important factors which I would like to stress about. One thing, it depends on the systolic BP. As we all know, when we tell the average BP recording, we tell it as 120 by 80. 120 is the systolic BP and 80 is the diastolic BP. This is the average BP recording which we talk about. So when this systolic BP goes higher up, so the acute rise in systolic blood pressure, so depends. So this has an effect on the amount of target organ damage. And there are some auto-regulation this is happening inside the body. Like once the BP rises, so there will be some regulatory process which can happen in the body, like the blood vessels in the kidney. So these blood vessels in the kidney, they try to protect our kidney in the early stages by managing their tone. So when the BP rises to such an extent that this management by the kidney can't happen by itself, that is the time when the kidney changes start happening. And there will be accumulation of protein in the urine. So, and the patients can notice that whenever they urinate, they will form a foamy or a frothy urine. So that's when we ask them to check it regularly. So they can develop some amount of giddiness in the and early onset, early morning headaches, and some amount of blurred vision whenever they notice these kind of symptoms, or excessive fatigue, like whatever normal regulation, normal activities which they have been doing, if they are feeling excessive fatigue in these areas. So which means the blood pressure has risen to such an extent that the body can't regulate its own blood vessels, the pressure reaching its own blood vessels, and it has reached beyond that level, so that the target organ damage keeps happening. So these are the things which the patient has to take care, especially in cases of hypertension. So one thing I would like to stress is maintain adherence to the treatment regimen given by the practitioner and avoid complications. So avoid complications is only by strictly adhering to the regimen and strictly following diet and lifestyle modification. And also keep an evaluation on the any other contributory factors like diabetes, or if there is any dyslipidemia, higher cholesterol levels, or if there is any genetic risk or genetic syndromes which can run in the family, any family history of first degree relatives or second degree relatives living with hypertension. So these are the people who should take even more regular care compared to the others for their management of hypertension. Especially when they have additional risk factors, their cardiac risk scoring, we calculate a score called ASCVD score. So this score includes all the other parameters like the diabetic or the hypertensive, if they have a history of stroke in the family, if there is any family history of hypertension in the family, or if there are any lipid disorders which can contribute to this. So these are the scoring parameters which we see whenever they have an additional comorbidity. So, and whenever they are found to be hypertensive or difficult to control hypertension, so we manage all these parameters separately and finally give them a score which can contribute to their cardiac risk and go about treating individually. So maintain your regimen and follow your diet and lifestyle interventions, and frequently approach a healthcare provider. So to let them know your existing hypertension status, and please don't deviate from the prescribed regimen. So it's not only important to keep your hypertension under target range, it's also important to prevent the end organ damage, which is our most primary concern in this era. Thank you.